hate to admit it, but nobody really likes going to the dentist. And as much as my patients actually like me, they don't like coming to see me. Truth is, none of us like to be sitting in the dental chair, none of us like getting dental treatment done, and nobody high-fives or fist pumps and goes, yeah, when they're told they have a cavity and that they need to come back for a filling. It's a bit like getting your car serviced and then, you get told you need 4 new tyres. First thing you think is, do I really need new tyres? And if I do I need them right now? Can I put it off a while? Because, it's going to cost so much and I'd rather spend my money on other things. Well, getting a filling is a bit like this. Firstly, do you really need a filling or is there another option? I'm going to answer that later. Secondly, do you need to have it done straight away? Or can you wait a while? Can you put that filling off for a period of time? Thirdly, we'd all like to know how to avoid the potential pain and discomfort associated with getting treatment. And 4, we'd rather spend our time and money doing something else. The other thing that you might want to know is, can you fix a tooth that already has a hole in it? And I will come back to that later. I get it. Even though I'm a dentist, I know nobody wants to get a filling or be told they have a cavity. I don't even like having to tell people that they need them. I don't like giving that sort of news. So my goal when I meet a new patient and then ongoing with my patients is to get their mouth healthy and keep it that way so they don't have to keep getting work done. So I'm going to share with you some ways in which we can do that and how you can work towards making your mouth healthier right there at home and avoid having dental visits and getting cavities. Now, I've got some notes that I'm referring to so that I stay on track and make sure I cover everything for you. So let's start where I promised. Do you really need a filling? Is there an alternative option? And can you fix that dental decay at home without the dentist having to pick up that scary drill and put a filling in your tooth? To be able to answer that, I do need to explain to you the difference between a cavity and dental decay, which is called caries, and then I can tell you what can be done and give you some advice on what you can do about it. Like you, I want to avoid getting a cavity and having a filling. And the reason why is because every time a tooth gets a hole in it, it has to be drilled and filled, and now that tooth is weaker. There's a joint between the filling and the tooth, and that is at risk of further decay, plus the tooth itself is structurally weak, and that means it could end up breaking and needing something like a crown. It's not uncommon for someone who has a tooth filled as a teenager to then need another filling in that tooth, say in their 30s, their 40s or 50s, and then later a crown. Because each time that tooth is drilled and worked on, the filling's got bigger. It involves more surfaces and structure, and the tooth is weak and at risk of fracture. Plus, all that drilling and filling and repeated decay put the nerve at risk of death because of the invasion of bacteria and the trauma of getting treatment. So do you need a filling? Well, sorry I'm going to be a bit vague and confusing, but the answer is it depends. So it might be yes and it might be no, but let me explain why. Also, it doesn't matter whether you have 1 or 2 cavities or lots. What matters is how big those cavities are, how far the decay has progressed through the tooth. Some cavities can heal and reverse, while others will need treatment. My goal is that we only fill teeth that definitely need work, and we help you reverse the ones that can heal and save you from unnecessary treatment and expense and having tooth structure removed that could have been saved and salvaged. Remember, the more fillings you get, the more work you're going to need to have done through your lifetime. And I want you not to be on that treadmill. I see this in my patients. The more dentistry that they had done when they were younger, the more they need as they age. And I often end up picking up the pieces. I'm the one working to repair and restore the function of these teeth. And as I'm doing this, I'm often wondering, could this have been avoided? Could there have been a better and a different way? And in most cases, I believe it could have been avoided and we should have done something different. Now, for example, I was told as a young dental student back in the 80s that I needed 4 fillings. Now, quite frankly, I didn't believe this because I'd never had a filling growing up. And even though, yes, my diet at university wasn't great, I didn't have a sweet tooth. So I decided not to have treatment and to get regular x-rays and reviews instead. And to this day, over 30 years later, those 4 teeth have not needed to be filled. And actually, I've never needed a filling because of decay. Unfortunately, I ended up breaking a tooth because of my bad bite, which I've since had corrected with braces, but hang on, that's a story for another day, so I won't digress. So what happens is this: the dentist has a look, tells that you need a small filling, and that gets done, and then as you age, that filling needs replacing, and then the tooth needs more work, and you get more fillings, the teeth have less tooth structure, and then you have more problems. What I want to do is support you to talk to your dentist, to ask the right and the best questions, to be better positioned to make the right decision and the best decision for your teeth and your dental health. I want you to avoid getting fillings. Unless there's no other option, just like I did, you don't need to have them done. Now, the good news is, if you have regular dental checks and x-rays, we can actually pick up early signs of tooth decay before they become a big problem. And often these early areas of what's called demineralization can be reversed and healed without you having to get a filling. But how do you know? How do you know if that's possible or not? Because after all, you're not the dentist. You don't know what's going on. And if you do have to have a filling, I want you to know what you can do to avoid getting another one and protect your teeth from dental decay going forward. This will involve changes in your oral home care, your dental hygiene, ensuring you have the optimum dental diet, and using things to help remineralize and reharden your teeth and stop plaque, the decay-causing bacteria, from building up and destroying your teeth. This is going to require the use of some natural mouth rinses and products like xylitol and probiotics. Okay, I know I haven't answered it and you must be getting a bit irritated. How do you know if you need that filling or not? With today's technology, we can detect cavities and the signs of tooth decay way before we could do it in the past. And this should have led to a reduction in the amount of fillings we do as dentists, especially if we're applying a preventative approach. But sadly, I think it means dentists are doing more fillings because they're jumping in too soon. They're too quick to pick up the drill and they're treating teeth that could have healed in the right setting. So I want you to be able to challenge this, not in a hostile way, but because you're educated and you're smart and you're empowered to know what's what and ask the right questions of your dentist. The first one being, hey doc, do I really need a filling, or is there something else we can do at this stage? Let me explain about dental decay, which is called caries, and what makes a cavity and what the difference is, because this is going to help you understand. Now, I'm not saying all areas of decay can heal. There is a point at which teeth will need to get fixed and filled because the decay is beyond reversal. But where the decay is small, we have other options. We can reverse the cavity. You don't need to have a filling because with the right tools, you can get rid of the cavity by dealing with the disease that causes it, the dental caries. Dental caries is a bacterial infection that causes a hole in your tooth and left untreated will rot away your tooth structure. And being treated doesn't always mean getting a filling, by the way. Treated properly and given time and enough time, the tooth can heal and repair itself. And you could have a tooth like mine and that healed and returned to being perfect and not needing a filling. Now, we used to think the majority of cavities took about anywhere from 6 months to 2 to 3 years to form. In some cases, it can be less, but in others, it's almost double that time. So in a lot of instances, we do have the luxury of time, and we don't have to rush to fill that tooth. We can instead attempt to get the tooth to heal and reverse the decay. This gives you an opportunity while the decay is small to apply those changes in diet, healthcare, plaque reducing and remineralizing promoting products that I'm going to recommend. If you understand how cavities start, then you also know how to make them stop and how to not get them in the first place. Cavities start with two things: bacteria and sugar. Bacteria, that's the infection of your tooth, that starts as a layer of biofilm, and if this is not disturbed and altered, it will keep growing and multiplying until you have a buildup of plaque on your teeth. The bacteria consume sugars and carbohydrates from your diet, and then they poop out acid, and that dissolves and weakens your tooth enamel, making it porous and more at risk from bacteria. And yes, I did say they poop out acid. I know, it's not a nice thought, but that's what's going on in there. And those acids demineralize and pull minerals out of your tooth. This commonly happens on the sides of your teeth, where, the in between the teeth, where they touch each other, or in the grooves and folds on the biting surfaces. These are the two common areas for early decay because it's where food collects and it's harder to clean it out. The bacteria then gather and they feast on those stuck bits of food. When you have a demineralized area in the outer layer of your tooth called the enamel, when your dentist takes an x-ray, that demineralized area will look black, which is what a hole in your tooth looks like. But at this stage, I would argue that it isn't actually really a hole. It's a patch of your tooth where the minerals have been removed and pulled out. And sometimes that shows even as a dark shadowed area when we're looking around at your teeth during the checkup. And while it may look like a hole, technically it isn't. It's an area where decay disease has started and it's attacking your tooth and it's stripping the shelves bare of the minerals where they were stored on the shelf. But this tooth doesn't need a filling. It does not need a filling because you still have the shelves, and those shelves can be restocked with minerals, and demineralization can heal. It can reharden. We do not need to drill. What that area is telling you is that something is wrong, that your mouth biochemistry is off, that there's too many bacteria building up, that there's too much sugar in your diet, and the biofilm isn't properly controlled and being broken up, and you are providing the perfect environment for your tooth to demineralize and the caries disease to destroy your tooth. But the thing is this: if you can provide the perfect environment to demineralize your teeth, would it not make sense that we can provide the perfect environment to remineralize, to reharden your teeth? Well, of course, the answer is yes. Now, if the bacteria have eaten into your tooth further than the enamel, then most likely, depending on the size of that, you're going to need a filling to remove the disease area of dental caries where the tooth has gone soft and mushy, and you're going to need to have a filling. But if this is the case, would you not want to make sure that this doesn't happen again by changing what caused the cavity in the first place? Hopefully, yes. Or what we want to do is, while the area of decay is small, the goal is to stop the bacteria from forming so you don't have them sucking all the minerals out of your teeth with their poopy acids. We want to remineralize and put the minerals back into your tooth so your tooth can reharden and fix itself. If the minerals get reloaded, it's like restocking the shelves that have been emptied, and your tooth can be repaired without you needing a filling. Now, you'd think that most dentists would know this from their training, and they wouldn't drill your tooth, and they'd give it a chance to repair. But as I said, this isn't the case. They see the shadow on their tooth, they see the dark area on the x-ray, and their first and only instinct is that you need a filling, and too late, they've drilled away the scaffolding and the shelving and the structure that could have been restored and restocked with minerals. But what if that decay is deeper inside your tooth and into the softer inner layer called dentine? Can this be repaired, or does that mean a filling is essential? Well, again, it's going to depend on how far inside your tooth that has gone and how close to your nerve the decay and caries is. Now, I'm not going to sell false hope. I'm not going to tell you that things can be fixed when they can't, because that's not fair and that's not correct. When there is decay and it's started to attack the inner part of the dentine, it can seriously damage the tooth and it can end up killing the nerve, which becomes infected, inflamed, and really painful due to the bacteria. And then you're going to need a root canal and further treatment. And I haven't forgotten, and I will come back to whether you can fix your tooth if it's got a hole in already or not. If the nerve is at risk and it's starting to get diseased in most cases, not all, you will start experiencing sensitivity and pain, toothache when you eat anything sweet, starchy, cold, or even acidic. You're going to get like a hit of sharp pain and then this dull, lingering ache that's going to last a few minutes. This is your nerve telling you that you are heading for big trouble and that the decay is serious and your nerve is being affected and compromised. This is a bad sign. By this point, things can turn very nasty and your tooth could die. So not only do you need a filling, you may also need a root canal to save your tooth as well, because the nerve may not recover from the infection. So the message here is do not wait until you've got toothache to see the dentist. I want you to avoid dental visits, but I don't want you to avoid going to the dentist. What I actually want is I want you to avoid getting a filling. And we can only do that if we can detect things early, make the changes to remineralize your tooth, and don't let your dentist just jump in and fill it unless it's not showing signs of healing. So if what causes a cavity is bacteria and too much sugar, poor oral hygiene, and minerals being sucked out of your tooth, then to reverse a cavity, we need to get rid of bacteria, improve your dental health care, stop eating sugar, reduce carbohydrates, and find a way of putting the minerals back in your tooth. And this is exactly what my 10-step formula for reversing a cavity does. So I'm going to share with you this formula right now. I will go into it in more detail on other videos, and I also have covered it on other videos. So I'm going to link those for you. So if you want to know more, it's right there for you. But let's run through it right now. Number 1, quit snacking and only eat at meal times. The more often you eat, the more food you provide for the decay-producing bacteria. Number 2, brush your teeth and clean your mouth properly to remove food and disrupt the biofilm and plaque formation. This involves brushing, flossing, interdental brushes, even a mouthpick or a water flosser. 3, use a toothpaste that contains hydroxyapatite to help replenish your teeth with minerals. Number 4, use a natural mouthwash to reduce bad bacteria and promote good bacteria and neutralize acids. 5, stop sugar and sweet foods and limit your carbohydrates. Number 6, eat foods rich in minerals and vitamins and follow what I call the dental diet. I'll link to some of those videos for you so you can refer to that. Number 7, supplement with vitamin D3 and K2 to help distribute calcium back into your teeth. Number 8, use xylitol mints or chewing gum after eating or drinking anything that isn't water, and then wait about 30 minutes or more before you have anything else in your mouth. 9, use a dental probiotic to put good bacteria back into your mouth and improve your oral microbiome so you have friendly protective bacteria. Number 10, reduce your stress and get more sleep, as stress and poor sleep weaken your immune system, then make you more acidic and cut your body's ability to heal and repair. I would advise that if you're going to take this approach, you let your dentist know that you'd like to try and remineralize your cavity and ask how long they think you can go before you need a filling. I would normally advise my patients 3 to 6 months, and no more than that if you're applying all the things I've suggested in the 10-step formula. The key is to stop the disease and give the tooth a chance to remineralize. And look, it may be that we do need to do the filling, but at least you've given yourself the best chance, and now you've altered the course and the cause of events. so that going forward, this hopefully can be the last filling you ever get. Now here comes the disclaimer and the answer to the question. Can you fix a tooth if it's already got a hole in it? If your tooth is caved in, if it's chipped or broken away, this 10-step formula will not work. You need to have intact enamel. We need the shelves to be still standing if we're going to restock them with minerals. If your tooth has an actual physical hole with enamel missing, it's too late and you will need to get a filling. Once the tooth caves in, you have a cavity and that has to be restored. This doesn't mean you should throw your hands up in the air and just give up and not apply the remineralization program I've shared with you, as this will slow down the decay and prevent more problems going forward with your other teeth. So please don't think that you can fix a hole like this without dental care. But you can fix and reverse areas of decay, caries, even in some cases if they go into the dentine, so long as you don't have sensitivity and toothache. The dentine can reharden because the tooth is porous and the minerals can get inside, and so can the mouthwashes and the xylitol and the good bacteria from the probiotics. You can't do that with flossing or something like oil pulling. Flossing does not fix decay. It just removes food and bacteria from between your teeth, and that's why I do like you to floss. So what's next? You apply the 10-step formula. You give 3 months or up to 6 months if your dentist and your tooth say it can wait that long. Remember, if you've got toothache or your tooth caves in and gets a hole, it's too late. You need a filling. After your 3 to 6 months, you need to go back to the dentist and you must be prepared to have another x-ray. Because what we're looking for is signs that the enamel is filling in and that dark area, the hole, is not as dark or as big as it was. Ask your dentist to show you the x-rays so you can see any changes for yourself and note if the enamel is healing or not, which if you've put the right work in and made the changes, it should have. Remember, demineralized subtype mineral areas look black, and when they start to remineralize, you will see that they will become lighter grey or white again, and this means your tooth is repaired and you've reversed the tooth decay. Make sure you watch this video here, as I know you're going to want to watch to know how to eat and prevent and heal tooth decay and really put the 10-step formula to reverse cavities into practice.